Post-traumatic stress disorder, or PTSD, is a mental health condition that can develop after experiencing or witnessing a terrifying or life-threatening event. These events, often referred to as traumas, can range from natural disasters and accidents to physical or sexual assault and combat experiences. It's important to understand that PTSD is not a sign of weakness. It's a normal human response to extraordinary stress. Many people who go through trauma experience some difficult emotions afterward. This is a natural part of the healing process. For some, these feelings fade over time. For others, they persist and can interfere with daily life, signaling the presence of PTSD. Men in particular often face societal pressures that make it difficult to talk about their struggles. They may feel the need to appear strong and stoic, leading them to bottle up their emotions and avoid seeking help. The reality is, PTSD can affect anyone, regardless of gender, age, or background. Acknowledging the problem and seeking support are crucial steps toward healing and reclaiming your life. PTSD can manifest in several ways, each with its own set of characteristics and symptom patterns. Understanding these different types can be helpful in seeking appropriate treatment and support. First, we have acute stress disorder, ASD. This type is diagnosed when symptoms last less than 3 months after the traumatic event. While it may be shorter in duration, it doesn't mean the symptoms are any less severe. Next, there's chronic PTSD. When symptoms persist for 3 months or longer after the trauma, it's classified as chronic PTSD. This form of PTSD can significantly impact an individual's ability to function in daily life. Then, we have delayed PTSD. In some cases, symptoms of PTSD may not surface until 6 months or even years after the traumatic event. This delay can make it difficult to connect the symptoms to the trauma, leading to confusion and misdiagnosis. Finally, there's complex PTSD. This type often arises from prolonged or repeated exposure to trauma, such as childhood abuse, domestic violence, or being held in captivity. Complex PTSD can lead to more severe and wide-ranging symptoms, including difficulties with emotional regulation, relationships, and self-perception. While the core symptoms of PTSD are similar across genders, men may experience and express them differently due to societal expectations and learned coping mechanisms. One common manifestation is, this can range from increased frustration and impatience to explosive outbursts of rage. Road rage, verbal aggression, and even physical violence can be signs of underlying PTSD. Another way PTSD can manifest in men is through. This might include substance abuse, dangerous driving, risky sexual behavior, or engaging in other activities that provide a temporary escape from emotional pain. Many men with PTSD also experience, they may feel disconnected from their loved ones, lose interest in activities they once enjoyed, or have difficulty experiencing joy or pleasure, is another hallmark of PTSD. This can involve staying away from people, places, or situations that trigger memories of the trauma. Men may isolate themselves, withdraw from social events, or avoid conversations that touch on their experiences. Coping mechanisms and treatment. PTSD is treatable and recovery is possible. Treatment involves therapies, coping strategies, and lifestyle changes. Seeking professional help is crucial. A mental health professional can provide a diagnosis, treatment plan, and coping mechanisms. Therapy, cognitive behavioral therapy or CBT, helps change negative thought patterns. Eye movement desensitization and reprocessing, or EMDR, uses eye movements to process traumatic memories, and group therapy provides a supportive environment. Medications, antidepressants, and anti-anxiety medications may be prescribed. They manage symptoms like depression, anxiety, and insomnia. Self-regulation techniques, deep breathing, progressive muscle relaxation, and mindfulness meditation help manage PTSD symptoms. Lifestyle changes, regular exercise, a balanced diet, and sufficient sleep are essential for well-being. Avoiding alcohol and caffeine is crucial, as they can worsen anxiety and sleep problems. Seeking help and finding support. Overcoming the stigma surrounding mental health, especially for men, is essential. Seeking help is not a sign of weakness, it's a sign of strength. Remember, you're not alone in this journey. Start by reaching out to your doctor or a mental health professional. They can provide a safe space to discuss your concerns. Numerous resources are available to provide support and assistance. Mental health hotlines like the National Suicide Prevention Lifeline offer immediate support. Recovery from PTSD is a journey, not a race. Be patient with yourself, celebrate small victories, and lean on your support system. With the right help and support, you can overcome PTSD and live a fulfilling life.